in cancer, the uniqueness of cancer is unless it reaches advanced stage, there are no signs and symptoms. That's why cancer awareness prevention is most important. The womanhood cancer is the #1 cancer in India. If you leave the breast cancer, gynec cancer, the cervical cancer, uterine, ovary constitutes almost 2/3 of cancer in India. So, being aware of cancer education, screening protocols specific to cervical cancer like HPV and then PAP and then mammogram for women in breast and then looking for endometrial cancer ovary is very important to save your life, identify cancer early and spread the message.
Ovarian cancer affects nearly at least 1 lakh people in India. It is the third most common cancer affecting the women in India and also one of the leading cause of death for women affected with cancer after breast and cervical cancer. Why is it a silent cancer? The symptoms that ovarian cancer produces are so subtle that usually many of them get neglected and they are usually noticed in advanced stages. And as we all know, advanced cancer is always a killer. The management of advanced ovarian cancer needs advanced tools. The latest in the world is hyperthermic intraperitoneal chemotherapy and pressurized intraperitoneal aerosol chemotherapy. HIPEC, as we call in short form, is one of the way to manage advanced ovarian cancer. HIPEC has shown to produce very good disease control and also good quality of life. People affected with advanced ovarian cancer initially undergo a major cytoreductive surgery in which all the visible cancerous cells, tumor deposits are removed, and then it is followed up immediately with a heated chemotherapy bath inside the abdomen that is done by a FDA and CE approved machines. This has shown to provide significant control in ovarian cancer disease. PIPAC, pressurized intraperitoneal aerosol chemotherapy, the latest advance in management of advanced peritoneal cancers because of ovarian cancer. PIPAC allows us to give chemotherapy directly into the abdomen in the form of aerosol with pressure. With 1/10 the dose of chemotherapy, we can provide and get the maximum benefit. PIPAC has minimal side effects. It's a daycare procedure done by a single port laparoscopy camera and a 10 mm port. Along with this, it is easy to have control of the disease, and also sometimes it is possible that with successive cycles of PIPAC, we might actually be able to operate the patients. So, HIPEC and PIPAC in advanced ovarian cancer have become a hope in patients. From nope to hope, HIPEC and PIPAC, we at Aster Whitefield Hospital, Aster International Institute of Oncology, the center that boasts the Center of Excellence for Ovarian Cancer, provide the best of cancer care in ovarian cancer.
From a medical oncology perspective, treatment of ovarian cancer entails targeted therapies and tailored chemotherapy. Ovarian cancer, as we know, presents in late stages, so timely intervention and precise treatment is essential. So by raising awareness, we can encourage women to come up and consult their doctors with vague symptoms like pelvic pain or bloating. Such symptoms should be given attention, and we can treat ovarian cancer effectively.
So cancer is a word associated with weight and fear, but knowledge is the most powerful weapon. So today I'm here to discuss about uterine cancers, which is a often overlooked health issue, yet a very common cancers affecting the women. So who are at risk? So usually women postmenopausal or perimenopausal are at risk. They present with bleeding or spotting per vaginum or lower pain abdomen or a watery discharge. So we can diagnose cancer very early with a simple biopsy done on an OPD basis and an imaging with a clinical examination. So detecting it early is the most crucial part because treatment depends upon that. So what is the treatment? So surgery forms a mainstay. So here we offer a cutting edge treatment, that is the robotic surgery, a minimally invasive way to tackle the cancer with precision. So robotic surgery, what are the advantages? It's less pain, lesser chances of infection, faster recovery so you can get back home at the earliest, so enhanced precision, and in addition we have an additional technique called the ICG Firefly technique. So ICG is a dye which maps the lymph nodes, so where the cancer is more likely to spread. So we identify it with a near infrared light, so we can harvest that, and that tells us an accurate stage, and we offer the treatment which completes it at the same setting. So to conclude, we at Aster International Institute of Oncology offer a comprehensive, a multidisciplinary care and a tailored approach to all the patients with cancer. Thank you.
CA cervix is the second most commonest malignancy affecting the women worldwide and also in India. Beyond stage 1B, locoregionally advanced CA cervix are commonly treated with concurrent chemoradiation. That is, chemotherapy and radiation delivered simultaneously together. With the advancement in the radiation technique like IGRT, ARC treatments and image-based brachytherapy, we are able to achieve very high cure rates and very high survivals along with very minimal toxicities to the patients. We can achieve more than 90% of the local control and about 80% 5-year survival rates even in very advanced stages like stage 3 and stage 4A. CA cervix is commonly associated with human papilloma virus infection, which is persistent in the cervical area, which turns into malignancy. There are vaccines available for this disease, which our women folks should make use of it.